In the study that we presented this year at ASH, we collected clinical information from a registry study cohort of Spanish patients from the Grupo Español de Trasplante de Terapia Celular and el Grupo de Lymphoma Español. What we performed in this study was to compare a patient who received, after having failed 2 or more lines of therapy, the use of therapy with anti-CD19 CAR T cells, commercially available product, and referring to Tisacel and Axicel, or patient who received allogeneic stem cell transplantation consolidation after a reinduction therapy. The results of our study show 2 things. The first one is that the 2 cohorts of patients are very heterogeneous, and they are unbalanced in the sense that the patient who received anti-CD19 CAR T cell were characterized by an older age, having a higher ECOG score, and of course having a much inferior percentage of patients with not chemosensitive, with chemosensitive disease. Actually, in the CAR T-cell 19 cohort, more than 90% had disease with stable disease or progression before receiving the therapy. And that's the contrary for the patient with allogeneic stem cell transplantation. Even considering this unbalanced characteristic, which were favoring a priori allogeneic stem cell transplantation cohort, we showed that overall survival outcomes were the same between the 2 groups in terms of both overall survival and progression-free survival. However, allogeneic stem cell transplantation show to have a higher complication rate and a higher non-relapse mortality. And that was statistically significant also in multivariate analysis. So our conclusion from this study is that the use of anti-CD19 CAR T cell before the use of allogeneic stem cell transplantation for patients with large B-cell lymphoma is justified. So this is supporting what we are doing currently with guidelines